Hello, folks. We have a few people still trickling in, but I think we can get started. And actually, before I do anything, before I even introduce myself, I really want to start by saying thank you. And thank you on a couple of levels. Number one, thank you for taking the time to be with us today. Your time is valuable. We understand that, and we're really privileged that you're spending this time with us today. But more importantly, thank you for being customers. You are all customers. You've been with us for a number of years, and your business is incredibly important to us. So I can't enough times say thank you for being a customer. Let me tell you who I am then. So my name is Tim Kelly. I'm an executive director here at Athena. I've been here about 13 years. Now you can tell by looking at the screen that I've actually been doing this longer than that as well too. So I worked at for software companies and healthcare IT going back, even companies like IDX, which is actually part of Athena now. And I have the pleasure and honor of doing a couple of things in my role here at Athena. Number one, I manage the Athena Practice sales team. So for those of you or any of your staff that engage with us to purchase any products or services complementary to Athena Practice, that's my team you're working with. And then additionally, we work to part of this program, for instance, is an effort to work with our customers, our Athena Practice customers, who are looking to make a transition to athenaOne. So we put together some programs and tools and things like that to enable that. So those are what my roles are here at Athena. And you all are here because you're at some level of interest of learning about athenaOne and making that move from Athena Practice to athenaOne. Some of you, this may be the very first interaction you're having on this, and some of you may be well deep into the process. And certainly, we've got groups of all different shapes, sizes, specialties, etc. So our attempt today here is to paint sort of a wide swath here of information about athenaOne. We're not going to get deep into a specialty or anything like that. There is plenty of time for us to do that through this process, and we would love that opportunity to engage there. But we're going to hit a little bit of a wider path here today. And so I'm going to kick us off by just talking a little bit about athenaOne and sort of why athenaOne. What is athenaOne all about? Why are organizations moving to athenaOne? Then our top hits is going to be actually a demo. So we're going to have Dr. Todd Clark, who's a practicing ER physician and on staff at Athena as well. And he actually is what I call bilingual. So in other words, he actually was with Verint, GE, prior to coming aboard with Athena. So he can demo both Athena Practice and athenaOne. So he knows both products really, really well. And he's a great resource to show you what the power of athenaOne is compared to Athena Practice. After Dr. Clark is done, I'll take just a couple of minutes to tee things up for the best part of the day, which is we're going to have a panel discussion with a couple of our customers. So Ken Getz, who's a VP of Customer Success here at Athena, is going to moderate a panel with two of our customers. So you can see on there, Tina and Amy, by the way. Disclaimer, Tina and I are not related, even though we spell our names the same way. But Tina's with Mountain View Medical and Amy with Raleigh Neuro. I think Amy came over from Athena Practice to athenaOne with Raleigh Neuro about 3 years ago and Mountain Medical about 2 years ago. So you're going to get an opportunity to hear from them about their experiences, sort of soup to nuts, beginning to end, about all they've experienced and really get good feedback from them along the way. And we want to take questions from you as we're going because we want to make this interactive, not disruptive though. So we're going to ask you to put your questions in. You see that Q&A button there. Click on that, put your question in there, and we'll look at those on the back end, and then we'll work them in at the end when we have a Q&A session at the end of the client panel. So we'll work them in there as best we can. If for some reason we're not able to get to your specific question, I promise you we will follow up with you directly afterwards. All right. So I think we're ready to get going, and for me to sort of talk to you a little bit about, again, sort of why athenaOne. And I've sort of come up with four things these are not all being, if you will. These are not all the reasons. But to me, four biggest things that are really going on in the industry, going on in healthcare that are super impactful to organizations like yours and are a lot of the reasons, in addition, that groups are looking to move to athenaOne. So the first is you think about all the bolt-ons you need these days, right? There's so many different things. Your needs as an organization have grown and evolved so much with the market, et cetera, that there's so many different things that you need to buy and maintain, right? Different third-party applications. Some of them you may actually buy through us, some of them you may buy elsewhere, but all of them have to interface together. They have to work together. You have to coordinate all that, and you have to pay for it as well, too. And those things sort of keep stacking up on top of each other and are a bit of a challenge, I think, to many organizations. Similarly, there's a lot of manual work out there. I like to joke that, the 80s called and want their fax machine back, right? But in healthcare, we are still firmly in the 80s when it comes to things like fax machines and so much manual work that happens within groups today. So it is a huge challenge, both from the ability to deliver great care, but also to grow and be profitable in your business. And it also contributes to the third item here, which is burnout. We've been hearing about burnout in practices for so long, be it providers or staff, right? And let's be clear, let's be very honest with each other. One of the big things, the top of the list of what providers in particular talk about with burnout is EMR, right? It's their challenge with an EMR that makes their jobs more difficult and more of that manual work as well, too. And then lastly, you all are getting squeezed in multiple directions. You're getting downward pressure on reimbursements. You're getting upward pressure on costs with inflation. And the whole COVID staffing thing, it's still there, right? You're still challenged with keeping your staff on board and keeping good staff on board. So these are the four things that I think of that are big factors in the market right now. And again, a lot of the reasons why folks come to look to athenaOne. And so let's dig into that just a little bit more here. So this slide, please don't try to look at every single thing on this slide. This is meant to just be a visual type of thing to talk about the fact that when you think about your world today with Athena Practice, there are lots of additional bolt-on things that you need to buy and to manage, right? And in the athenaOne world, those are both, by the way, products and services that you need to procure. And in the athenaOne world, most of those things are part of athenaOne. They're part of the service that we provide, whether it's the technology components, services, or even products. Even things like patient statements, as an example, are part of the service that's provided within athenaOne. So this idea that you have it all in one place with one vendor, one solution to manage and keep a lot more cost effective is a big driver for organizations looking to consolidate all those different add-on solutions. Now, there's three obviously different components to athenaOne. And so in ways that we drive, optimal efficiency. So revenue cycle obviously is not only just the practice management component we call collector, but there's also services on top of that you can procure. So you could add things like authorization management or coding, et cetera, et cetera. And a lot of this goes to the concept of what we talk about as comparative advantage. This whole idea that you think about your organization, you think about what your mission or vision statements are, what's really important to you as an organization, right? And there's lots of things you have to do every day that don't go to anything about that mission or vision, right? There's things like posting payments or scanning documents or a number of things that are not core to who you are and why you deliver the best service and best value to your patients, right? So this concept of comparative advantages, have someone like athenaOne take over some of that work by automating some of it as well, too, so you can focus on the higher value things. So we do that throughout, but certainly revenue cycle is one area for sure. From a clinical experience point of view, obviously there's the EMR, and you're going to see that today. But it's also, you're going to see today our ambient solution as an example. So when we talk about that burnout that providers are having, this is a tool that's going to wow you in the ability to get the docs' noses out of the screen as much as possible, right? And have them really focusing on the patient. And then patient engagement is incredibly important, right? Patient engagement is what keeps your patients stickier. And let's be honest, they're not just patients, they're consumers. And so they're looking for consumer grade type of application for you to keep them sort of engaged, how they do business, how we all do business in sort of every part of our lives today. So let's dig into a couple of those just a little bit more. From a clinical point of view, from a documentation point of view, we've got a couple things going on here. Seamlessly exchanging patient records is one thing for sure that Athena does really better than anybody. We've been so focused on this from day one, how important it is that not everybody's going to be on Athena, right? So the ability to exchange records with all different types of entities is really core to what we're doing. Accelerating documentation. I mentioned the ambient solution, but even beyond that, think about our business model for a second, too. Those of you who are familiar with this whole concept of what we call aligned incentives. So this aligned incentives concept, some of you may think of it around revenue cycle a little bit more. But if you think about it from a clinical point of view, if we're able to help you accelerate documentation, to see more patients, to have your providers happier, you're going to be more successful and we're going to be more successful too, right? So think about it in terms of those perspective as well. And then easily informing care, having information at the point of care, especially from a value-based care point of view. And then, as I mentioned, consumers, patients / consumers expect, I'm trying to find my phone here. They expect, she's got her phone. They expect us to be, they expect to use these in so many different ways, whether it's ordering food or getting a flight or doing your banking or whatever it is. They use technology to interact with all parts of their life. And as you see on the screen here in this study, fully a quarter of patients surveyed said, hey, if I can't get that kind of engagement from my provider, I'm going to go elsewhere for it. So it's really, really important that you have a full strategy around patient engagement. And athenaOne helps enable that. And as I said, these are truly consumers, not just patients. And what it allows us to do when you have a really good patient experience, it makes those patients stickier, right? They're going to be more likely to stay with you if they've got a way to interact with you electronically and in a meaningful way that they're going to stay with you. You can use that tool to drive better results within your practice too. And I'm talking about clinical results as well. You're doing things like campaigns, identifying all, folks over 50 that haven't, had certain procedures done, colonoscopy, for instance, in X period of time, right? And being able to get information out to them and get them booked, et cetera, and giving them the tools to do that. And you're going to get paid more as well, too. And we can show this through the tools that we use because we're on this network, right? And we can measure things and see how we're doing. And we do things like A/B testing, where we try different messaging to say, hey, how does this work? How does that work in this audience? Which works better? And how do we pivot to ensure that we're going to get the best results? So all these things are fundamental to keeping patients engaged and healthier, and you getting paid more as well, too. All right. And then last slide before I turn things over to Dr. Clark is just, as I said in the beginning, it's incredibly important to us that you are all customers today, and we value that. And because we value that so much, we put together programs to give you the most favorable pricing that we can. We give you, if you look to move to athenaOne, we'll put a deal on the table that is below market and wouldn't be given to any other organization that isn't a customer, that isn't a current Athena practice customer. So we give a lower rate. We'll also try to do everything we can to lower the upfront fees. Moving from one EMR to another is a big deal on a lot of levels, operationally and financially as well, too. So we're going to do everything we can to limit the burden financially of you making that move over to athenaOne. And then lastly, because we've done this so many times, we've done this almost 400 times now, Athena practice customer moving to athenaOne, we've gotten really good at it. And we've gotten really good at moving the data over as well, so that we can do that in a much more automated way that doesn't involve you, doesn't take as much time out of your day as well, too, to make that move over to athenaOne. So hopefully that's a good picture of sort of where what athenaOne is all about and sort of why organizations are making the move to athenaOne. All right, so I've gone through that, and what I'd like to do now is turn things over to Dr. Todd Clark, who's going to walk us through a demo. Todd, over to you.
Thank you so much. Dr. Todd Clark here, a practicing ER physician in the Chicago area. I'm in the ER part-time these days, have been for a number of years, as my full-time job is a medical director of clinician experience here at Athena Health. And I came to Athena Health by way of the merger once from GE, where I was working on the Athena practice and Athena Flow systems previously for about 10 years. So very familiar with those systems. And what I'm here today to do is to show some of the highlights and differences between Athena Practice and athenaOne Clinicals. Now, we're going to start off with Athena Clinicals on the desktop. We're also going to then show you the athenaOne Clinicals provider app on the iPhone. And that is going to include one of our newest and greatest features, which is ambient notes, which basically listens to the conversation between a provider and a patient and generates that note for them. So with that, let's go ahead and dive in. So the first thing you'll notice that's different about Athena Clinicals is that we're a web-based platform. So you can see that immediately that you log in with a simple username and password on any web-enabled device. This is really nice because if you happen to be on call somewhere, you're a hospitalist going between settings and you need to access Athena Clinicals from another computer, say your brother-in-law's computer, you're at their house for dinner, you can just pop open their laptop and log in. It's not a problem whatsoever. I'm going to go ahead and make the screen full screen. That's another thing that's nice about it being a web page. You can enlarge the screen. It's got spell check, all those things that are, slight differences with Athena Practice. So there's a number of other things that are part and parcel to Athena Clinicals that I can't show you, but I want to talk to about before we dive in and see a patient. These are invisible things that run in the background that make a huge difference because Athena Clinicals isn't just software. It's also a lot of services wrapped around the software. Some of those services are automated. Some of those services are via AI. Some of those services are with real people. So I'm going to speak to each one of them very briefly. First and foremost, my schedule is dense because Athena Clinicals performs automated eligibility checks, make sure that we're going to get paid for the services we provide. We also do automated appointment reminders to patients. We send those out and patients can respond, whether they received it via text or phone or through the patient app. They can say yes to confirm, 2 for no, and 3 to reschedule. We can even allow them to self-schedule if that's something that you want to empower your patients to do. The flip side of that is what we call call campaigns. So for example, maybe Cindy here was notified that she was overdue for a mammogram through one of our call campaigns. This is a campaign that can be scheduled to run periodically where you identify all of your patients that are due for a preventative health type of service, whether it's a mammogram, colonoscopy, follow up on their diabetes, and generate a list of whether it's 10 or 10,000 patients. Athena then picks up the list of patients and sends out personalized messaging to those patients through what we call our call campaigns. So again, your staff didn't have to lift a finger and you've already tracked down, identified, and helped out, potentially thousands of your patients. Similarly, Athena applies our economy of scale and collective intelligence and some automation when it comes to your inbox. And in particular, what I'm talking about here is our one-of-a-kind document management system, which intercepts all of your inbound faxes through AI and people, classifies the document, figures out what kind of document it is, which patient it's associated with, and goes the one step further than I think anybody else can do. We figure out if there's any associated order with that result that's coming in. So whether that's an MRI result or a consult note from the cardiologist, we can then close the associated order. Of course, if those results come in through an interface, we're going to close that order as well. But this ability to do it with a document that's been faxed is really unique. And what it does is it rounds out our very robust closed loop ordering system. Because each order in Athena, whether it's a follow-up order for an appointment or a lab order, consult order, they all can have alarms baked into them so that if we don't have those results in, whether interfaced or faxed, that order will fall into a needs follow-up bucket because it has been too long. We have not yet received the expected results. So here, for example, Betty Holly is due for a note from the cardiologist. It's been several weeks. It's past the alarm, and so we know that we now need to reach out to Betty or the cardiologist and find out what's going on. So that's part and parcel, again, of Athena's mission to kind of wick away menial tasks from your providers and your clinical staff. One other way we do that is you no longer have to go through those time-consuming upgrades periodically. You're always on the latest and greatest version of Athena. One of the other things that it means when we are web-based is that we can monitor your clicks on a page. So for example, we can see if Dr. Clark, you're taking 20 clicks to get through a visit that most clinicians get through in 5 or 6 clicks. Can we show you some personalized methods of improving your efficiency through our accelerators and other clinician coaching? All these services that I've described so far, whether it's patient reminders, call campaigns, the document management, clinical coaching, this is all included in athenaOne. As a platform, we think it's critical. We know that your success is equal to our success. Your provider's happiness equates with our happiness and satisfaction. So just really wanted to emphasize those points before we go in and see Jake Medlock. This is going to be our first patient. Now, as I'm looking at my schedule here, there's a couple other things that I really want to point out that are different between athenaOne Clinicals and Athena Practice. First and foremost, we have telehealth, which can be baked right into Athena Clinicals. This is a simple link that the patient gets texted at the beginning of the day when they're having their telehealth appointment, and a reminder to join when it's time for their appointment. You can even send messages to the patient that maybe you're running a little bit late, and you can join similarly here from within the Athena desktop or even the mobile app. You'll notice that I have prepped here associated with Jake's chart. I can start prepping Jake's chart from the moment he's scheduled. So I can start skeletonizing my note, drafting orders. I may even want to go into our care gap work list where I can see, regardless of the reason that Jake is coming in, all the different services he may be due for related to his care, and utilize that to help draft up orders for his upcoming appointment. And so this is our ability to integrate some population health information into the system. And what that looks like is this. This is our care gap work list. And here we can see that Jake in particular, here's the status of all these various quality measures and guidelines that Jake falls into because of his age, gender, and problems. We're also fed with information from outside payer sources. So whether that's from our population health solution or whether that's from Humana or any other variety of payers, we will also have their information integrated in for the most up-to-date and robust picture of Jake's health. One of the other key things that I think is really important to point out is if labs come in, and maybe multiple labs on Marcus Torres here come in, you can review all those labs. Any abnormalities jump out at me in nice red, bold format. But once I review all these labs, I can sign off on all of them at once and message those over to the patient. I've got an indicator, if the patient is registered for the portal. I can add notes to the patient about how things look. And I can even use some dot phrases there. Maybe I want them to come in as soon as possible to get seen. And I can, of course, save this or add orders or even schedule a follow-up. I'm prompted as to when the patient's next office visit is. I've got his home phone number up here in the banner to help drive efficiency within the system. And another difference is the ability to sign off in bulk, whether it's prescriptions, vaccines, labs, or DME that was queued up by your staff. All you have to do is click a single box and then sign off and approve those orders en masse. As soon as the patients are arrived, a clock starts ticking, and as they move through each status within the clinic, moving from arrived to ready for staff, to being seen with staff, to ready for provider, and then finally seen by provider and checked out, we're tracking all those times and throughput, and you can run throughput reports to see where you might be having bottlenecks. And again, our customer success managers are going to help you digest some of that information and figure out ways to drive efficiency for you. So those are some distinct differences I definitely wanted to highlight between Athena Practice and Athena Clinicals. Let's go ahead and see Jake now. So when I enter into Jake's chart, there's a lot of nice design features here that really help me focus on what I need to do today. First and foremost, my intake staff's information, vitals, appointment reason are all right here front and center. But also I'm prompted with my last assessment and plan on the patient so that I can quickly get up to speed as to where we were the last time we met. And I can see that he was trying to diet and exercise to lower his cholesterol. One of the other things that's nice on this page is I can look at the recent activity for this patient. So this is going to be the delta between the last time I saw him and his visit today. That's going to include not only things that were done associated with our plan to follow up on his cholesterol, such as his lipid panel here, but also the fact that maybe he went to an urgent care in an outside facility. And that is visible to me here in this recent activity as well. We're integrated with Commonwealth and Care Quality, allowing us to pull in records from outside ERs, urgent cares, hospitals, even other ambulatory clinics that are on those nationwide file sharing networks. Much of the ECW, NextGen, Epic, and other clinics are also integrated in, and we can pull in the records from those outside entities. We can extract from those records allergies, problems, labs, vaccines, and even reconcile those into the patient's chart. So thinking about the fact that we would like to get caught up to exactly where we are with Jake, I'm just going to go ahead and open up his lipid panel that we'd ordered the last time, and here are those results. And unfortunately, it looks like Jake's lipids are still trending in the wrong direction, and so we are going to have to, in fact, start that statin after all. If there were any outstanding orders that Jake did not have completed the last time he was seen by me, those would show up here, as well as any follow-up appointments that he has scheduled or that he needs to schedule also show up here on the patient briefing page. So you can see you get a really nice snapshot of exactly where we're at, where we were, where we're at today, and where we'd like to be. I do have the ability to navigate through the patient's chart over here on these left-hand tabs, including a nice search capability where I can simply enter a few keystrokes and find whatever I might be looking for, whether it's that cholesterol panel or maybe a consult note from the ophthalmologist, or even a continuity of care document. So quick and easy to get to those findings. We do extract the patient's medication lists from their medication fill history, and we can display those right here within the patient's chart. That can even include the trend of dosage, when the patient picked up their medication, when it was prescribed, when it was filled, all that good information, so that, again, you have a really clear and full picture of patients' compliance with medications. We're also integrated with your state vaccines, so we're a vaccine registry, so we're going to display those prominently. And there's a lot of other nice features within the chart that you can take advantage of. One of those is also the fact that we track quality measures, and our tracking of quality measures is not dependent on clinical chart updates the way that they are in Athena Practice and Athena Flow, meaning that as soon as results come in, they are going to start satisfying these measures. So if Jake had a colonoscopy and the colonoscopy report came in, not only are we going to close that associated order, but it is going to satisfy this quality measure for colorectal cancer screening. Similarly, if I look at the patient's problem-based flow sheet, in particular, maybe I want to look at his cardiovascular risk score. If the patient had a new lipid profile, which he did, that lipid profile is going to impact his 10-year ASCVD risk, and it's going to automatically recalculate that for me. I don't need to do anything for the system to recalculate this metric. All right, well, after looking through Jake's chart a bit there, I'm going to go ahead and dive in and see Jake.
Good.
And I'm going to be using a combination of methods of doing my documentation. When I first go into the patient's note, you'll notice that his problem list slides open for me automatically as a point of reference. In the middle of my panel, I have a preview pane, which is going to get me up to date on some other information that's going to be relevant to today's visit in particular. And that includes the reasons for visit that have already been documented. Now, remember, these might have been documented by myself ahead of time. My staff might have contributed to this if that's something that you want them to do, but this could all be part of chart prep. But let's say that while I'm talking to Jake, he says, Doc, in fact, I've got a skin tag that's been irritating me since I started exercising more. I'd like that removed. So I can go ahead and add that as a new reason for visit, and he would like to have that removed today. So I just want to show you that, it's quick and easy to add those reasons for visit. It's going to add that skin tag to the patient's problem list, and even can queue up orders for like a procedure template that we're going to get to in just a minute. Now, I can also review here the patient's vital signs, that blood glucose that was done as a point of care test as an automated test, simply for the fact that the patient's coming in for follow-up of his diabetes. We just have that as a protocol, so that was in place. No one had to go in and enter that order. They just entered the results. Similarly, Jake might have been automatically prompted to fill out a PHQ-2 during his check-in process. If that's something that he was due for, maybe I do that annually, and he was due for that this year. Through our patient app, patients can fill out any number of screening questionnaires, and those will be automatically ingested and displayed here in the patient's chart. So as I'm talking to Jake, he also says, Doc, I'm running low on my metformin. Can you renew that for me? And quickly and easily, I can click this arrow here that's going to what we call accelerate metformin over. You can see as I hover, it gives me information about the last time I prescribed it, who prescribed it, and puts that metformin in. One-click renewal, very simple and easy. The other thing that's great about this is I didn't have to change screens, right? I didn't have to open a dialog box. I simply slid open his medications drawer here, added that in. There was no mental switching of screens and complexities that can come with that. So for his HPI, I'm going to go ahead and use voice to text. This is what we call Athena Voice, which is our partnership with Nuance, where speech to text is embedded right within the athenaOne mobile app as well as the desktop app. So anywhere and everywhere I go, I can use speech to text. Patient presents today for follow-up of his cholesterol labs period. He's been dieting and exercising more lately to try to lose weight and get his cholesterol under control, but his recent labs do show his cholesterol remains high period. We've talked in the past that we'll have to start him on a statin at this point period. He's also noticed that he's got some irritation of the skin tag under his left arm from this increased exercise recently. He'd like to have me remove it today, period. Go to review systems. Stop listening. So you can see there's some ability to navigate through the system with voice because of my the embedded Athena voice features. Now, if I wanted to add a review of systems to this patient, I can, of course, click through template choices like this. I did want to demonstrate the use of templates here. I can also, though, use what we call a save findings. This is my personalized choices of that template. This is a typical review of systems I ask my patients, for example, which is unique to me as a provider. It was quick and easy for me to save. Once I had that template in place, I made my selections. I clicked this star, saved it for myself, and then it's always there for me to use. For a physical exam, I'm going to go ahead and pull previous. So this is another, I just want to demonstrate another means of documentation within Athena Clinicals. When I go to pull a previous HPI, review systems, physical exam, I'm going to be prompted with both the date and the user that generated that previous piece of documentation, and that way ensure that I'm drawing on the correct piece. Here you can see that this was a dedicated PE related to specific to diabetes. I could see that by the fact that I'm doing my monofilament test down here. And more or less in this patient who's got chronic medical problems, not much has changed except for the fact that now he's got a new skin lesion and I can add that in. Now there's no skin lesion on the template, but I can put in skin tag, left axilla, red, irritated. So you can always add on the fly. The other thing you could do to supplement your documentation is utilize something that we call Athena Capture. This is a HIPAA compliant photo app that is on your phone. It does not store the photo on your phone. What it essentially does is creates a link between this QR code, which is linked to the patient's chart, and then whatever you take a picture of. So here I just pointed my phone at the screen, took a picture of the patient's skin tag, clicked upload, and in just a few seconds, you're going to see that appear within the patient's chart. And so this is useful not only for a physical exam where you might be tracking a mole or a rash or a skin lesion, but also in a procedure. You can add these pictures into a procedure. You can also utilize Athena Capture to upload documentation, so paper documentation into the patient's chart. So here, for example, I'm going to go ahead and document my procedure. This procedure is going to be automatically mapped to the procedure code so that I can make sure that I'm going to bill for and collect on everything that I do for the patient. So you don't have to remember to enter that code later on. So at this point, I'm going to wrap up his assessment and plan. The system does call my attention to the fact that Jake, as a complex medical patient, might have multiple medical problems that need to be addressed this year in order to treat him with the sophistication and complexity that he needs. So what we do in Athena is we track the patient's risk score associated with their HCC-related problems. And if the system notes that I haven't addressed all those problems this year, it's going to give me a prompt, but then I can jump over into the patient's risk dashboard and see all the potential diagnoses that the system has identified that would impact the RAF weight of this patient's risk score overall. So for example, we know that in a previous year, we treated Jake for diabetes with complication of neuropathy. The other thing that we do, though, besides looking internally at claims that we've submitted over the last 3 years, is we offer up information from payers. So here, for example, a payer may have paid for a medication related to COPD. And so we're surfacing the fact that some provider at some point diagnosed this patient with COPD. It's not on the patient's problem list. We have not addressed it as an HCC code yet this year. We should, and Athena is prompting the provider to consider doing so. So we did see him for his hyperlipidemia today, and I do want to start him on a statin. So I'm going to go ahead and add my medication. The system's watching my prescribing habits, my ordering habits, and it's surfacing my most frequent prescribing and ordering habits to the top of that list. So nobody has to manage this list as a curated list for me as an individual. The system's just doing it for me automatically. Makes it almost one click for me to go ahead and enter this. It put in all the pertinent information. All I have to do is enter the duration of therapy. The patient's preferred pharmacy is automatically filled in, and Athena keeps track of all those directories, by the way, for pharmacies, providers, imaging centers, all their phone numbers, fax numbers, addresses. We provide maintenance of those directories, which is different than Athena Practice and Athena Flow for you admin folks out there. We also allow you to add and subtract pharmacies on the fly, anywhere and everywhere that you're prescribing medications. Once you enter that duration, we can then do a calculation with our prescription benefit managers, ensure that this is a covered medication, and get real-time benefit checks from them to see what the pricing would be. If there's an alternative to that medication that might be cheaper through a different formulation or a different pharmacy, we will offer that up to you as well as something that you could select. One other thing I'll point out here is that Athena owns Epocrates, so we have Epocrates monograph embedded right within Athena. The prescription drug monitoring report is also available in the assessment and plan and in the patient's medication list. Again, anytime you're looking at the patient's med list or prescribing, the PDMP is visible to you, and simply by clicking on these chevrons, you'll be able to see that report, and we're logging your activity of viewing that report in the background for auditing purposes. Now, I do want to put in a simple bit of text regarding treatment for this patient for his hyperlipidemia. And again, remember I mentioned here that this is quick and easy to save as a custom field as well. So if I had just typed this, for example, and I wanted to save it for the first time, I would simply click this star, name it, and it would be there for me in the future. For patients' diabetes, it seems like it's well controlled. And I can simply add in any text that I'd like to for that treatment plan. Under good control, period, no change in medications, period. As I mentioned before, all of our orders do have alarms on them. So if Jake is due for getting his lipids redrawn in a week, and that doesn't happen again, that won't fall through the cracks. Somebody on my team will reach out to him. Now, proactively, we actually even remind the patients that they have these orders due through automated order reminders. We do have patient handouts that come out of the box. From HealthWise, you can, of course, generate your own custom handouts and utilize those as well. Maybe I'd like Jake to follow up with me in a couple months just to recheck those labs. So maybe I want to have a lab work follow-up appointment with him in 2 months. And again, that's going to trigger both a tickler for my staff to ensure that they contact Jake if he doesn't schedule with us, and also some reminders in Jake's patient app that he has that appointment due. Yeah. The other thing left for me now is to make sure that my charges are entered. We do have an E&M coder that's built right in. It looks at whether the patient is new or established, and we can indicate the level of complexity. The system will automatically generate that E&M code and insert it right into my billing tab. We can see here that not only are the E&M codes associated with the diagnoses, but several of the other things, such as the skin tag removal and CPT2 codes, are automatically generated. Once I sign my charges, billing is processed by my staff with Athena's rules engine to make sure the claims are clean and paid on for submission. But additionally, Athena staff works with my staff taking on work at scale that allows my staff to focus on just specific high-value claims. And we can see that in the workflow dashboard. Where my staff can identify high-value claims that require their expertise to resolve when there are any issues. Now, at this point, I'd like to move on to the ways that Athena Clinicals allows both my and Athena staff to monitor productivity in a variety of financial and rev cycle dashboards, including our insights dashboards. These insights dashboards let you view your practice's performance and even offer up warning signs of what to look for, and even strategies you can use to drive more revenue. Here, when we look at more collections faster, for example, there's a number of key performance indicators that we surface to help drive revenue. For see more patients, you can understand your visit volume, provider counts, and visit throughput trends month over month and year over year. The same thing is true for performing higher value services, relating RVUs per visit and monitoring RVUs, improving payer contracts, increase in collection yield, and getting paid faster are all available because of our ability to analyze payer and patient pay yield, as well as the drivers of yield loss. Switching back to our main screen, of course, there's other reports that you'll be interested in running, and we have a very robust report library that offers reporting tools from KPI dashboard to a library of standard reports covering everything from scheduling, billing, clinical data. It even allows you to build your own reports with our report builder. So there's no dearth of the ability to run analytics, a lot of which can be scheduled to run and delivered into specific personnel's inboxes. Related to reporting, we also offer up the ability to manage patients at a quality level across populations. So with our quality management reporting, we can identify patients perhaps that need help with our diabetes control, and then generate that group call campaign that I referenced earlier, where we can reach out to every one of these patients with a personalized letter saying, hey, looks like your diabetes is a little out of control. Please contact us to schedule a visit so we can get that tidied up. From here, I'd like to switch over to demonstrate our athenaOne mobile app. The athenaOne mobile app is an incredibly powerful tool that you'll have in your pocket. Now, as I mentioned before, the athenaOne mobile app is designed to help you take your work on the go when your laptop's not around, and then you're no longer restricted by your desk. Now, what we've added to that is a voice assistant, which is really useful to retrieve information and perform complex tasks, navigate through the system, and especially while you're dictating, really reduces the keystrokes and taps that are required. So to launch into the athenaOne app, I can launch directly from the app itself or from one of these widgets. Maybe I got a new urgent inbox item, and the system just drives me right over to that area. I can see, for example, that maybe I have this urgent message from my staff. And when I tap into that, I can see that maybe I got a message from Jennifer Jones. She's got some symptoms of a UTI. Right. I can take a look at that message from her, and maybe I know her and I'm comfortable prescribing her some antibiotics. So I'm just going to go ahead and do that. And I do notice that she's got an allergy. So I'm going to check on that and make sure that she's not allergic to the antibiotics that I'm going to prescribe her. And it looks like she's allergic to codeine after all. So at this point, I can simply say, hey, Athena, order macrobid twice daily for 5 days for this patient for diagnosis of acute urinary tract infection. The system goes out, places that order, adds that diagnosis to the patient's chart, and drafts this up so that all I have to do is click send, and it sends the prescription right over to the pharmacy. I can, of course, then use voice to also send a message back to the patient through the patient portal or app, or back to my staff if I want them to reach out to her. But we just make it quick and easy for that to be accomplished through voice commands. Of course, you can perform any of those commands using touching the phone as well, but just try to demonstrate how easy it is with voice. Now, we also embed voice as simple speech to text within our system. So here is April Fitz. Maybe I saw her earlier today, and I want to complete my documentation on her. She had come in with an injury to her leg, or some redness that she wanted me to look at. All I have to do is click this microphone button, and it takes me right into where I can start my documentation. Patient presents today complaining of pain and redness in her right leg where she scraped it a week ago period. She's noticed worsening redness over that time and is concerned she has an infection period. She's had no purulent drainage and no fevers period. And I can simply swipe through to get to my next sections. If I'd like to, I can utilize a template so I can mix and match my documentation styles here within the mobile app. I'm not just restricted to voice, so I really wanted to make that clear. And personally, I also find it very easy to complete physical exam documentation using templates. As for her assessment and plan, add text macro skin infection. Patient states she'll continue to monitor the wound with her daughter, period. Stop listening. At this point, I'm done with my documentation. I can simply add my orders to the patient's chart. Hey, Athena, add skin infection order set. So whether it's an individual order or whether it's an entire order set, the system can help you and be driven by voice commands to complete your ordering and documentation. And again, all I need to do is sign off on these orders. The final piece of the mobile solution that I'd like to show you is our new ambient notes. And with that, I'm going to need some assistance from my colleague, Dr. Kathy Rokavik.
Well, hi, Kathy Rokavik. I'm also a physician with Athena. I'm a family physician by background. Let's kind of go through a visit here. So I'm going to be seeing Todd Clark, and you see he's ready for the provider. So I can go into his chart just like you saw Todd do earlier, kind of review it before I go in to see him. You know, he's been here before. I kind of remember him. So I'm just going to go ahead and tap on that start ambient that you see there. It's going to bring up a consent, and this is just, you know, whatever your organization decides to do as far as consent to let me know that I am ultimately responsible for the content of this note. I'm going to click continue, and then we're going to start our visit. Hey, Todd, it's good to see you again. I haven't seen you in a while.
Yeah, hi.
Hey, so what's going on today? What can I help you with?
Yeah, you know, I've got this rash on my arm and it's been bothering me for a couple days now.
Okay. Have you noticed any changes since it started?
Yeah, actually, I think it started kind of as a smaller patch, but now it's really spread and it's kind of, you know, stings and burns. It's like really inflamed. I've been trying to put some over-the-counter hydrocortisone cream on it. I think that's what it's called, but it doesn't seem to help very much.
Okay. Does it itch or cause any discomfort at all?
Yeah, it's really itchy and now it's starting to burn and kind of hurt.
Oh, okay. Any idea what might have caused it? Have you used any new soaps, lotions? Have you been exposed to anything new or unusual?
Think. I haven't changed my soap or lotions, but now that you mention it, I was hiking last weekend with my dog, and you know, she's like 6 years old, but she still thinks she's a puppy, so she ran off into the woods, and I had to kind of go chasing after her. So maybe I came in contact with something when I was doing that.
Oh yeah, you know, that could be. You know how those dogs are. What kind of dog do you have?
She's a lab mix. She's super cute. I don't know. She's a rescue, so I don't really know what the rest of her is, but yeah.
Nice, nice. All right. Well, yeah, it certainly sounds like that you may have gotten into something with Chase and her or so. Okay, and how have you been feeling otherwise?
Pretty good. Yeah, pretty good.
All right. I remember you've been in here a couple times for your asthma. Have you had any problems with that? Has that been under good control?
Yeah, actually, I think it's under decent control. After the hike, I had to use my inhaler a little more than usual. I think, just because of the molds and things at this time of year. But it seems to be getting better now.
Okay, great. Well, let's take a look at you. Oh, you mind for 1 second? I have to check on something. This is just kind of show you that if I get interrupted, as we often do, I can just hit that pause button. I can exit out of this and come back. We're going to continue on with the visit. All right, so just looking at your rash. So it's just right here on your right forearm.
Yep, that's it.
Yeah. Okay. Yeah, that looks pretty irritated. Kind of raised red. Let's see. It's just located on the medial aspect of your right forearm. And if I measure it out here, it's probably about 8 centimeters by 5 centimeters. I don't see any drainage, and you don't have a rash anywhere else. It's just in this location.
Right.
Okay. All right. Great. And let me just take a listen to your lungs, since you were having a little bit more of an asthma flare-up. If you take a few deep breaths, yep, your lungs sound clear. You have good air movement. I don't hear any wheezes. So just kind of keep using that inhaler as you need it. And certainly if you feel that it's, getting worse, you're having to use it more often, just let us know or come on back. So I think this is a contact dermatitis of some kind, whether it's, it could be poison ivy, could be anything that you reacted to that caused, the irritation. Sometimes even small changes in what you're using daily, but I think it was probably due to that hike. So I just keep the area clean and dry as much as possible. I'm going to prescribe a more potent steroid cream, hydrocortisone cream. You'll use that 3 times a day until it resolves. If you're not seeing any improvement within the next few days, or if it's getting worse, please come on back.
Okay. All right.
Sound like a plan?
Yeah,
Okay.
It sounds great. Thanks. I hope it works.
All right, Todd. Good to see you, and take care.
All right. Thanks. You too.
So I'm going to tap preview the summary. Now, this is going to take around 30 seconds to actually generate that note. So here in this draft summary, you see I can actually select individual options here. So if I just want the HPI to go over, I can tap that. But in this case, I do want the entire summary to go right over. So I'm going to send that over, and then we'll take a little bit closer look at the generation of the note. And you'll notice, I intentionally did a little bit of small talk asking him about his dog. So here's our HPI. See, it did say he was hiking with his dog, but didn't talk about what kind of dog it was. So if it's not really pertinent to the visit, it's not going to record it. And you'll notice I kind of talked through my physical exam, and it did record that. I think some providers will be more comfortable with either using that template like you saw Todd use earlier, or dictating the physical exam after they leave the room. And then here's our assessment and plan. And you'll notice that it did break out the asthma as a second diagnosis, and it did include the plan. Even though I didn't dictate them necessarily in this sequence or talk about them in this sequence, it still put them in the appropriate place. Currently, this will not do the ICD-10 coded diagnosis. That is a future plan, and as well as orders. So it will not create the orders currently, but it will discuss them in the plan, and that is on the roadmap. More to come, but I think it's pretty exciting.
All right. Thanks, Dr. Workavik, so much. That was fantastic. Such a cool feature. And with that wraps it up for me. I'm going to pass it off to the next presenter. Thanks, everybody.
Dr. Clark, thank you. That was fantastic. And Dr. Rakovich, that was just great walking through all that. And hopefully everybody got a lot out of what you saw there. And again, we'll have an opportunity for you to go much deeper into your organization, your specialty, et cetera, if you so desire. So couple things for me just before we turn things over to the panel here. Just want to sort of paint a picture of sort of the process of what you would go through. Those of you who've already started the process of looking at Athena, moving to athenaOne, that is. But I just sort of want to paint a little bit of a picture from beginning to end, really high level, before we tee it up to the panel. So there's 3 sort of components I want to talk about. Number one is in that sales process, we'll call it, where you're looking at athenaOne, I want to talk about client solutions, what they do. Then onboarding, what that's all about. We hit on that a little bit before, but I'll go a teeny bit deeper. And then customer success. And I feel a little bit like I've got Ken looking at me while I'm talking about that, since he's the VP of customer success, but he can always straighten me out if I say anything wrong. So just in terms of when you're looking at athenaOne, making this move, we have a team we call our client solutions group, and they're folks that come from really all across different aspects of Athena, and often sometimes our customers as well. They could be coming from onboarding, from the customer success, from operations, et cetera. And so they bring with them a whole bunch of knowledge and experience. And so what they're tasked with doing with you in that process is getting to know the organization really deeply, beyond the relationship we already have, but into the details of workflow and all that kind of good stuff, and being able to paint a picture for you. Here's what the world looks like today, and here's what the world should look like on athenaOne. And it's an iterative process that we go through together to say, both from a operational, financial, clinical, et cetera, point of view. So you really can understand. It's very important to us that you really, really, truly understand what you're getting into and what things will be like once you move to athenaOne. Once you make that decision to move forward, I did hit a little bit on onboarding before, but the thing is I want to reiterate with our onboarding team is that, again, we've done this lots of times, taking folks from Athena Practice to athenaOne. We've got really good at moving the data across. And the other thing that I think is a huge advantage is, like Dr. Clark is bilingual, many of the folks on our onboarding team that you'll work with are also bilingual. Again, came from the Athena Practice world. So they understand Athena Practice, they understand the language, they understand the product, and they're a great resource to help you make that move across over to athenaOne. And then lastly is customer success. And again, you have a customer success person today, which is fantastic. And again, that was something that came about 5 years ago when Verance and Athena came together. So it was one of the many things that we did to add value into the Athena Practice customer base. And a great team that Rhea Davis runs. Fantastic. But there's a couple of things, and Ken will probably hit on this a little bit, and our client panel will probably hit on this a little bit too, that are just different in that there's just a set of tools that are available in athenaOne that allow the CSMs to really interact with you on helping you improve your business, right? And you'll hear a little bit more about that. And you saw a little bit of that with Dr. Clark and the insights that he talked about. And then lastly, it's just the business model is different, right? So the business model is such that, again, it's aligned incentives. So the customer success folks are they're measured on helping you be successful, not just answering your questions or dealing with problems, but literally helping your business be successful. All right, so that's my little bit of part to sort of ramp us up for this client panel. And so with that, I'm going to turn things over to Ken, and I will join you again when we get back to Q&A in a little bit. So Ken, over to you.
Awesome. Thanks, Tim. It's a real pleasure to be here today. And as Tim mentioned, my name is Ken Getz. I have the privilege of running customer success for both Athena Practice and athenaOne clients. And I can say with authority that we absolutely obsess over our customers. One of the things that makes Athena really special, that Tim kind of mentioned, is that every client at Athena gets a customer success manager. And those CSMs work tirelessly to help their customers adopt Athena, optimize Athena, and more importantly, to ensure our clients are getting the return on the investment that they've made in our software and our services. So today we have some fantastic guests joining us for our customer panel. Amy Roberts is Director of Health Information Systems and IT at Raleigh Neurology Associates, where I do happen to live in Raleigh, North Carolina. And we also have Tina Kelly, Director of Operations at Mountain View Medical Center. So first of all, thank you, Amy and Tina, for joining us. Appreciate you coming here. And so before we begin with the questions, maybe we can just take a moment to learn more about you and your practices. So we'll start with you, Amy. Could you please tell us about your role, your background, and your practice, and how long you've been on athenaOne?
Absolutely. Yep. So I have been, well, in the EMR world for many, many years. I don't want to date myself too much, but let's put it this way: there's some things called logician and some IDX and some things way back in the day. So I really came from that Athena practice world. And really jumped onto athenaOne August of 2022. So, Raleigh Neurology is a mid-sized practice. We have about 50 prescribing providers, see about 500 to 600 patients a day, have all different types of ancillary services related to neurology. We have pediatric neurology, MRI, sleep, EEG, pain, things like that. So, but made that jump to athenaOne, and I'm happy to be here today.
Awesome. And before we move to Tina, Amy, can you just share with us a little bit about what makes your practice unique?
Ooh, that's a good one. Well, I mean, we think we're special and unicorns and amazing, right? Um, I would say as far as being a private practice but large, right? And so we're not affiliated with a hospital, but we have three major hospitals in the Raleigh-Durham area that deliver patients to us, right? So we strive really hard. We need a really efficient EMR that interfaces well with all the things. And so I think that as far as like what makes us different would probably be that we've been in practice for about 40 years. So we've been doing this a little bit. And so we're still making it work.
Okay, great. Thank you. And Tina, please share a bit about yourself, your background, and your practice, and how long you've been on athenaOne.
Yeah, sure thing. So I've been here at Mountain View Medical Center for over 10 years. Prior to that, I still kind of worked in healthcare. I was an emergency dispatcher for 17 years before I made that transition solely into healthcare. So a little bit different type of healthcare that we were providing over the phone, but still kind of in that same realm, and just kind of fell in love and had the opportunity to come here to Mountain View and jumped on the chance, and never looking back. So we have been on Athena since November of 2022. So we just hit our 2-year mark last year. Super excited. It's hard to believe that it's only been 2 years, actually. It feels like it's been a lot longer than that. But, coming from Athena practice, it was an easy jump for us. And I think now if you were to go poll our providers, they would tell us that, no way would we go back to Athena practice at this point. We're sticking with athenaOne. So that's super great. We are a small clinic in terms of primary care. So we're, we have 4 doctors of osteopath and 14, or I'm sorry, and then 10 additional mid-level providers, nurse practitioners and physician assistants. We also have integrated behavioral health here in our clinic. So we have 1 licensed professional counselor that provides mental health counseling to our established patients, which is amazing in this day and age. But we are literally the epitome of family practice. So we were founded by Tim Gray, and we have now since been joined by his 2 sons. So we have 3 Dr. Grays, which is not confusing whatsoever, said no one. But it's really great. We're in a metropolitan area, but we are still able to provide that small town feel of family practice. So our doctors are still known to do house calls periodically for those patients that maybe can't come into the clinic. And it's just really great to be able to see where we are at, multiple generations of family that we've been able to serve here in our community.
Yeah, that's fabulous. And my next question was going to be, what do you think makes your practice unique? But I think you kind of covered that already, unless there's anything else you'd like to add.
No, I think that's our big standout thing. I love telling that to everyone that, who makes house calls in this day and age really still, right? So
right,
it's kind of, you just kind of have that picture in your mind of a doctor with his house call bag, and that's what we get to see periodically. It's really neat.
Awesome. Okay, great. All right, well, let's pivot into some of the different areas of interest. I think first up is the whole decision-making and conversion process. And my next question is for you, Amy, is what were the driving forces behind your decision to change systems? How did you go about doing that? Was it a formal process? Did you look at other vendors? What can you tell me?
Yeah, Yeah, absolutely. So of course we looked at other vendors, right? I think that's you have to do your due diligence. But what was the driving factor was really our not that we were struggling a little bit. So we had a third-party portal that was no longer really being supported through the systems we were using. So our messages were failing to patients. Our servers were old. And so we had a lot, we were on prem for our IT for Athena practice. And so it was time to update or upgrade or things like that. And so really thinking through, okay, how do we want to do that? What's the next step? And quite frankly, we just felt like athenaOne, when we started looking, had the new features. Like it's kind of comparing the iPhone 6 to the iPhone 12. Like, it's just there's the next steps, the next things that are available. And maybe even we were a flip phone at the time. We were struggling a little bit with some of our technology. And so we knew that it was time, right? So when we sat down and we started evaluating, we picked pretty much any EMR we could find out there, right, to start reviewing and going through the process. And then we had a committee that was made up of some docs and some nurses and just kind of a group that we chose and said, hey, we want to meet. And then we narrowed it down based on just conversations to like a top 3, top 4. And then we had demos of those and talked through and really kind of tried as much as possible in a sales cycle process to compare apples to apples instead of having all the different ways to look at things. And so that's really how we kind of decided. And I will say unanimously was athenaOne.
Oh,
So,
wow.
yeah.
That's great. So Tina, kind of similar question for you, but as you're coming at this a little bit different angle as a former Quattros Healthco customer that was also very involved in Chug. So why and how did you look at making this change?
Yeah, so in all honesty, we weren't actually looking at making a change when we actually did. The kind of the opportunity arose, and we started looking at the capabilities that would be available at our fingertips, and that's what the catalyst was to really start to think, okay, maybe we should dive in a little bit deeper and start looking more. I do want to preface it with we love Quattros Healthco. Can't say enough good things about them and the care and support that they gave us while we were with them. But really, one of our core values here at Mountain View is that if it improves patient care, we do it. And so as we were looking at athenaOne, we kind of had that value in the back of our mind and really evaluated every piece and functionality that athenaOne would give us over what we had with Athena Practice. And when we kind of set those, similar to what Amy said, right, like comparing apples to apples, when it came right down to it, the efficiencies and the effectiveness that we added by switching over to athenaOne, I mean, it made the decision for us, in all honesty. We did look at other EMRs as well, but yeah, Athena just stood out in that form and functionality.
Yeah, that's great to hear. So maybe we can talk a little bit about your partnership with Athena as you went through the process. And so, Amy, I'll direct this question to you. Let's talk onboarding. So how did our teams collaborate with you ahead of the go live and during the onboarding process? What worked well in onboarding? What didn't work so well?
Yeah. So, and things are a little different now. I will say, I think just as Athena has been improving, like, right, it learn as you every time you do one, you learn, right? But I will say, as we started out, we were assigned a project manager, and they helped us out. They came on site with us as how we had organized them, and walked our facility, helped us figure out, understood us, right? They looped in, I think we talked about the bilingual, looped in the bilingual team, right? To make sure that we were all talking the same language, because sometimes, I say, well, I want to do a flag, and that a flag doesn't exist in Athena, right? athenaOne. And so having those conversations to understand, okay, well, how will this workflow change? And also taking a step back and realizing, just because you did it this way doesn't mean you have to do it this way forever. Like there could be a much more efficient way to do things that better helps the patient, better makes the team member more efficient. So really looking at those processes. We also divided, and Athena assisted with this, divided us into what we call work streams, or what you all call work streams, and I've adopted it here as well. But we had a clinical work stream and a financial work stream. And so we had team members that were in charge of kind of each of them. And then I was kind of the overall project manager on our side. And so that we were able to focus and really dig into things because it is a lot. I mean, switching an EMR is a big deal.
Right.
And so being able to think through each piece so that all of it got taken care of and was rolled out efficiently as possible.
Yeah.
Yeah. And I guess
Yeah.
maybe what you asked me what I would do differently or what didn't work. I think I kind of skipped over
Yeah.
that.
Like what didn't work so well?
So we struggled with, and I think anybody would, we thought we were amazing and we were unicorns. I think I said that earlier, that we would be fine, that we weren't going to have any dip. We didn't need to shorten schedules. We're going to be fine. Like, come on. So I think really taking a step back and realizing, okay, go a little bit slow to go fast later. I would have probably done that again. I mean, and Athena recommended it. They're like, hey, maybe think about this. And we were like, no, we'll be fine. I wish that we would have listened a little bit more in that and maybe not being so, it's not going to happen to us feel.
Yeah, I think that's actually really, really good advice. Another part of this is that there's always going to be some sort of functionality that doesn't exist in the new EMR. So how did you manage that with your staff and providers?
Is that for me or Tina?
That's
Me
for you,
still?
Amy.
Oh, for me
Yeah.
still. Okay.
Yeah, sorry.
I'm so sorry. Yeah, no. So functionality that doesn't exist. I mean, it's kind of like you're getting something taken away possibly, but if you look at it differently, is it this, it's not even the same anymore, right? And let's try it. Let's give it a moment. I am amazed now because when we have had to log back into Athena practice for whatever reason for something, everybody's like, oh, wow. I think they just at first changes so hard and it's so just difficult to adopt. But just talking through workflows with using Athena's resources right off the bat and incorporating them to help you figure out the workflows, that's really what you got to do because it doesn't, all the functionality isn't the same, doesn't mean it's wrong. It could actually be better. Just have to be open to it.
That's actually a great segue, Tina, for my question to you. And Amy hinted at this. No one really likes change, right? So how did you get the staff behind the project and what kind of a difference did that make? Are there any specific lessons learned, or what would you do differently that our audience should keep in mind?
Yeah, I think nobody likes change is kind of an understatement, right? Like,
Absolutely.
for sure. And I think especially when you consider longevity of those team members that maybe you have at your practice too, you have to take that into consideration as you're making a change. There are some people that can go with the flow and adapt it to the change and adopt it relatively easily. And you maybe have those that aren't so easily to adapt. So for us, the biggest thing that just propelled everything and really helped streamline the rest of the team coming on board is finding essentially a team champion that could speak to it. So we have a nurse practitioner. It's actually, her name is Karen. And I joke all the time that she was our Karen. She was the most outspoken person against changing EMRs. She's been with us for over 30 years. And so she's been here since paper charts were a thing, right? And then the reiteration of going to Athena practice. And then now she was like, I don't want to change. Everything is perfect the way it is. There is no reason. And so we really kind of brought her into the fold and said, you know what? We want you to sit in every single meeting that we have with our implementation team. And granted, we took a full year to implement. So we were meeting weekly with our team to kind of get everything in place for that go live date. And we had her sitting alongside of us the entire time. And so she was able to see and provide feedback as we were creating those workflows on the back end. And then to hear her talk about, yeah, it's not the same as Athena practice, but here's what it can do. And
Right.
so even those people that maybe weren't as, upset about the change, but maybe apprehensive, she was able to quell any of their concerns just because she was seeing it firsthand and was just our biggest proponent for it. And we ended up doing that same type of thing kind of with each department almost. Just having a champion in each of those departments that can speak to it. That's not somebody in management, because I think too that that's a huge thing. Like, it's one thing for me to go out there and sell somebody something, but if somebody that's sitting right next to them day in and day out is doing it, it kind of holds a little bit different weight. So for sure, anything that I would do differently, probably the only thing is I would have found a Karen at our second location. Karen, although she goes back and forth, right? She's mainly in our Forest Grove location. So I think I would have found another one of her in our second location, just so that there was somebody there day in and day out that could speak to it as well.
Yeah, I love that focus. You know, people are the users of the system. The system does nothing without the people, and so they have to be really central to the whole process of onboarding. And it sounds like you came up with some creative ways to deal with that. I'd like to now, if I could, pivot to something that's very close to my heart, which is the customer success piece of this, the post live experience. And so, Tina, I'll stick with you here. How has your CSM contributed to your practice's success since transitioning to athenaOne? Maybe you can talk about your cadence, like your monthly calls, and in what ways has your CSM been proactive, and what does that mean for you?
Yeah, I think it's always a little bit scary, right? When you go, for us coming from Quattrith Health Co., which is a smaller organization, right? And we were used to the type of support that they provided. We knew everybody by name. Um, Switching over to Athena, that was probably maybe our biggest concern, was what's that support piece going to look like when we're now kind of a smaller fish in a bigger pond, really. But our CSM, having someone assigned to us that we can know by name, and I have her email, I have her, phone number, her direct line, all of those things really made it feel like, okay, we're not as small as we thought we were. In Athena's eyes, we're actually a pretty big deal. So having her just as that person, our go-to that we can reach out to, not to say that we don't, submit support tickets to the customer success community, we do, but maybe if we're not getting the type of response we want, or we just want additional support, like, hey, can you take a look at this? Because we don't quite understand what we should be doing. She is there to answer that. In terms of efficiencies and effectiveness in our clinic, those monthly calls are super important, especially for me. As the director of operations, I'm meeting with my providers every single month to talk over what their efficiencies are in terms of seeing patients. And the reports that she's able to provide to us every month give me insight into that. So I can sit down with them and say, hey, you know what? Great. You saw this many, encounters this month. Love it. Why aren't you closing them in a much quicker rate? Like, you're kind of lower on these things, and just that level and granularity of metrics that she's able to provide. Although I could probably get it myself within Athena, it's great just to have her walk me through it. And that way I speak even much more intelligently to my providers when I'm sitting down with them and saying, hey, great, I see that you're not using some of these enhancers or these, I can't think of what they're called, accelerators. There it is. Let's talk about the why. Why aren't you using them? And it really opens up that channel of communication and lets me help them become better and more efficient and serve their patients better and efficiently.
Yeah. And the CSMs have a broad view of other clients and practices, oftentimes of the same size or in a similar market or specialty. So they're able to sort of bring to light best practices that you may not be aware of, and insights from data that you just may not be aware of, right? So that's definitely one of the value adds of a CSM. Amy, similarly for you, maybe you can share a specific instance where your CSM has provided support or resources that significantly impacted you. Can you tell us about not just CSM, but also overall support, the CSC, the success community?
Yeah, absolutely. I really like my CSM. I really, really like them. He, and to your point, has a lot of specialties that, like, a lot of the neurology specialty, right? So it's like and he also, so one of the big things for me and kind of a game changer that he has done is he helps with the user group. So he jumps in and he is kind of that sound person from the Athena side when we meet in a user group. So when all of the neurology practices meet, we all can collaborate with him, and then he's able to provide to all of us at once as we're collaborating, like, hey, you know what? There might be coaching for that, or there might be an opportunity where we can take a step back and do more. I mean, he absolutely is also my escalation path if I ever have a question on things, or if I'm struggling with how to word how I want to do an interface, because right now I'm trying to figure out how I want to do one, and I'm like, I don't know how to even open the ticket to ask for it. He's a great sounding board for that kind of thing. But as far as helping like our practice get connected to the other practices that are neurology based, like that's huge for us. And so I really, really appreciate him.
Yeah. You know, the CSMs on the athenaOne side have the benefit of additional tooling and insights that you don't have in Athena practice. So there's a lot more of an accentuated value add that a CSM can bring to that relationship. And I definitely see that on the athenaOne side. And yet I also know that both of you have been involved in user groups, and I'd love for you both to comment on that. Maybe Tina, you can comment first, and then Amy.
Yeah, I'm almost embarrassed to probably say how many user groups I belong to. I don't even know what the actual number is. But yeah, I think especially when we're looking at primary care, right? Like having a group, I'm going to speak to that user group, that I can go to and ask questions and best practices to that is specific to what the level of service that we provide is super beneficial. Granted, you know, we have contacts with other primary care clinics in our state, but sometimes it's great to have even a broader view of there's so many other options and ways to do things that maybe no one else is thinking of. So just having that group to as a sounding board, or even honestly to learn some workarounds, right? So it's super great. And I love we have monthly calls, which are phenomenal. Not just to, again, that sounding board, but also to learn of functionality that maybe we haven't become familiar with. And so we haven't fully grasped it yet. And then it's kind of that catalyst of, yeah, we should put some calories into this. An additional user group, I think I'm a customer engagement or patient engagement user group. I just started attending that one. And that one has been phenomenal just in terms of how can we really get our patients more engaged with our practice on a different level instead of just coming in to the clinic. Like how can we reach out to them? How can we use enhanced check-in? How can we use the portal and communicator more effectively? That has been really great to changing some of our workflows as well.
I saw you on that. Saw you on that last month. Good. I can go. Yeah. So same. I have a lot of user groups that I'm in. I think the more you engage with other like-minded practices, the better you're going to be. I do feel like, I mean, Athena is a partnership and they allow you to set up the relationships with others. And so why wouldn't you take advantage of it? I mean, I'm in a reporting user group, right, to help with figuring out different reports and how I can utilize the system even, more than I am now. I have a lot of light bulb aha moments with even like our neurology user group. I'm in the peds user group because why not? Because we have pediatric neurology. And so there's just across the board, and they're all a little different. Some are really big and they end up having more of a presentation style. Some are very small, and like our sleep one, I feel like everybody was asleep last month and we only had a couple, but we had a great conversation because we could just chat with each other and try to figure, okay, who's doing what for what. So, but yeah, user groups have been great, and just the entire success community too. I will call out, I mean, not just the group side of it, but then I think Tina had mentioned success community earlier, just the amount of articles that you can go in and discover things. And then if you want to know more, you can go to that community and ask and say, I have a question about this. Has anybody done this yet?
Yeah. Yeah. I'm really impressed with the ecosystem of our user groups, and yeah, our CSMs are part of the leadership of many of them. We are. It's not really marketing, and that's usually sometimes a problem with a user group is it becomes like a marketing thing, and it doesn't feel like that's the case here. They're really more organic, customer led, CSM led, and really focused on client success, which is great to see. Let me switch gears a little bit and ask for you both to share more about your experience on athenaOne. And Tina, we'll start with you, and maybe you can provide a few anecdotes about how the athenaOne mobile app or communicator or just other tools that you've used have improved your workflows compared to what was available with Athena Practice?
Yeah, I think athenaOne Mobile, right, many of our providers are just utilizing that every single day. And it's funny because I think when we first initially made that switch, they were just like, I can't imagine having my phone and doing anything on my phone. Like, why would I want to do that? And then it just took that one time of them recognizing, oh, wait a minute. You mean I can quickly, look at a patient case and see that, oh, this patient needs a prescription. Great. I'll send the refill right now in between walking between exam rooms. So I think that has been for them just a really great piece of functionality that they've been able to utilize, which then has helped to them manage that inbox a little bit as well, right? Because they can do it when they're not just sitting at their desk, but also on the go. For me, operationally, one of the biggest things is some of that AI that's built into athenaOne. I think it was mentioned quite a bit during the demo. But a big piece, especially for our front desk personnel, is that insurance eligibility. Checking that every time a patient comes in and having that be automated to, checking it 2 days before a patient comes in the door, phenomenal. But probably my favorite piece, especially we are in January, right? So everyone's insurance plans seem to have changed this year. It's crazy. But we're wanting them to bring in their insurance cards and get new pictures of those. We've now removed that guesswork from our front desk through the functionality built into athenaOne. So when they take a picture of that patient's insurance card, Athena is able to read it and determine not just the carrier, but also the individual plan, and then pick that correct plan and carrier within Athena to make sure that we are billing the correct insurance once we send those claims out, which has then minimized the level of hold that we're getting back or denial. So probably that piece of functionality is the biggest impact that we've had, just taking that guesswork out of it, right? There's so many plans out there to choose from. And if one less thing we have to try to mitigate our way through, the better.
Yeah. And similar to you, Amy, how have these tools changed the way your staff interacts with patients or manages their daily tasks?
Yeah, I mean, the one thing that I feel has changed us in just as an entire practice and just made us better from a patient care perspective is closing that order loop. So in Athena practice, some of it was by old design and how we did workflows, but we didn't do a great job of closing that order loop. When a patient would get an order, it wasn't a great clean process for us to follow along, where Athena has a lot more automated. athenaOne has an automated process, right? So it is very, you order and then it goes through a alarm system. So if like you don't get the results off of an order after a certain amount of days, it will alarm back and alert the staff. We didn't have any of that, right? So unfortunately, things being missed, right? So the biggest pull for us, and I think Dr. Clark even mentioned it, but that is huge for us. I mean, that is patient care 101. Are we making sure our patients are going and getting those things done, getting those tests done, and they have to have that MRI before they come back so that we can have the next discussion and decide if an infusion is the right answer, right? So for us, that to me, that automation of that, just, I mean, if we had like hours and hours of people putting time in to figure out if orders had been completed and what has happened and things like that. So having that all in that loop has been amazing. I will say, and I also have that whole Tina, like for me personally, I love the mobility of athenaOne. So like if I have to go log in somewhere else, like I don't have to be that at my computer, right? I can hop on a tablet. I can be on my home computer if I had to and go to the website. Like, I mean, yes, I have the MFA and I have protection there, but I love that. Like, I love the ability for the doctors to be able to maneuver around. It's a lot less tied to your desk feeling. It makes it just more efficient.
Awesome. Well, Tina and Amy, we have so many questions. I don't unlimited time, unfortunately limited time, but thank you so much for your thoughtful responses. Please stay with us though for a few more minutes. I think we're going to bring Tim back on. And Tim, if you could join us again and bring up any questions that came through.
Absolutely. Thanks again. Great conversation so far. Did get a couple questions. So, Tina, I think I'm going to come to you with this one. So there was a question about provider experience. Can you talk a little bit about how your providers, how they do with the EMR and how they made the switch over as well? Absolutely.
Yeah, I think I hinted at this a little bit, right? Like, I think if you were to go and pull them today, 2 years after we've gone live, none of them would jump at the chance to go back to Athena practice. Um, it's funny, Amy mentioned too, right? Like anytime you have to go back into Athena practice, we've now been on athenaOne for enough time that when we do go back, we've kind of all forgotten how to maneuver in it, actually. So it's almost like it's a whole new learning curve if we have to try to go find something in there. But yeah, I
Absolutely.
think just the amount of streamlined efficiency that is built into athenaOne has made their experience 10 times better. They're not having to, the amount of big things, which if there's any providers, I'm sure, or if you work with the providers, you've heard this, like the amount of clicks that they're doing any given time period is a huge thing. The less clicks, the better. And with athenaOne, there's less clicks for them. We can build so many efficiencies into their daily workflows. They're not having to go and decide which screening questionnaires they need to do for a specific encounter, because once that encounter is selected, all of the screening questionnaires populate for them and they're ready to go. I mean, orders can automatically populate dependent on the type of encounter or type of visit that they're doing. So all of those little efficiencies have saved them so much time that they can now focus where their time is most important, and that's with the patient, seeing them, caring for them, building that relationship with them.
Probably improves your life too, doesn't it now, Tina?
For sure. Yes.
Awesome. Amy, you alluded to this a little bit before anyway, but there was a question here about, how is Athena viewed in your minds as a partner and a collaborator? Absolutely.
Yeah. So for us, we've always I always kind of take that vendor is my teammate approach. And that is so key in this, right? And the fact that Athena has proactive communication that comes out as things are going on, the amount of training, and I will say, even tacking on to the end of Tina's answer, like the amount of training that is given for provider onboarding, for user onboarding, things like that. Like if there's there's quarterly releases. So if there's a quarter release, the information that is given to us to be able to help out, that to me, that's being a teammate, right? Like they're giving us, you guys are giving us, Athena is giving us what we need to turn around and get that information out to everyone. So I love that concept. I love being able to work together to figure out, because you guys want us to succeed, we want to succeed. So it's nice to have that everybody in the same team move forward. And I love that.
Awesome. And I have one more question here, Ken. I'm actually going to throw it to you, and then I'll send it back to you to wrap up with the panel as well afterwards. But there's a question here about how does Athena communicate new features, functionality, releases, that kind of thing, and then how do we make sure that our customers are trained and ready to take them on?
Yeah, it's a great question, and Amy sort of talked about this a little bit. Athena Health has a specific cadence where we do major updates. It's a very predictable schedule, and at least once a month prior to the release of new functionality, we publish something called a release center that provides in-depth details and video guides for all the upcoming changes. And what's really cool is it's sortable by staff position affected by the change or the product that's being updated, and by the level of change management and training that's required for each update. I think that's really novel how we do that. For particularly heavy changes that require a little bit more change management, like some of the recent scheduling changes, we send automated emails to practice staff, specifically to staff who are listed by their practice as responsible for training, to make them aware of upcoming changes and resources that are available. Additionally, to further support clients during releases, we hold a release walkthrough webinars to highlight key features that all Athena clients are able to attend or watch on demand. Our CSMs are very well equipped. They're provided with training and user guides, which they can then curate and with key features for their clients to share with staff as part of their regular touch points. And the user groups will also be supported and will also cover highlights and upcoming specialty specific changes and new functions. And lastly, just one really cool thing we do, about 10 business days prior to our release, clients are able to begin testing key features in a preview environment. So they're able to ensure that they're comfortable and aware of the changes, or or even make their own training videos for a more personalized approach for their practice. So we really do roll out, I think, the red carpet when we do major releases. And to me, it's a real advantage and value add within Athena.
So releases no longer cause PTSD, Amy and Tina, for your staff. Is that right?
It's pretty smooth. Yeah, I
Okay.
mean, we can get ahead of it and talk through any changes and things like that. It's yes, definitely better.
Awesome.
All right. Well, we just have a few minutes left, and I'd like to ask one final question to each of you. What is the best advice that you can give other Athena practice customers as they consider making this critical change to their business? And Amy, why don't you go first, and then Tina?
Yeah, I will say think through how you want to implement, like what you want to continue, what is not working in the old system. I literally make this joke every time I talk to somebody, don't put an ugly couch in a new house, right? We were building a house during the Athena implementation. I don't know why, but at that time, I'm like, can we just not put our ugly couch in it? Like, it's the same concept, right? Don't do what you've always done. Be open to opportunities for improvement, right? Athena does so many things well if you don't fight it, right? Don't fight the system because it does some automated things that will just make it so much better for your team member or your teammates, and it's just better. So as far as that goes, I would say be open to ideas from your implementation team. Changing an EMR is hard. It's tough. I wouldn't necessarily want to do it every year. But just know that you're going to get there. Be patient, be calm, and be open to anything that the Athena team is recommending because they've been there, done that.
Absolutely, absolutely, absolutely,
Go
absolutely.
ahead, Tina. Same question.
Ditto what Amy said. No, um, I think Ray, I spoke to it. Find your team champions if you're going to make that switch, and I think really bring your team alongside of you. EMRs have forever been just about the provider experience, but I think that's where athenaOne kind of sets itself apart. It's not just the provider experience, it's literally every team that it takes to make a clinic or a facility run efficiently and effectively. Um, they really pinpoint each of those individual places. So I think bringing all of your team members alongside of you as you're walking through this is super important because it affects everyone, and you want to make sure that it's the least amount of boat rocking as possible. And it will be. I mean, like Amy said, change is, we said it multiple times, change is hard. But just because it's different doesn't mean it's wrong. So changing your mindset of, yes, we may have done something the same way for the last 12 years, I think is how long we were on Athena practice. Doesn't mean that was the best way or the correct way or the only way. And really athenaOne has opened our eyes to kind of not just what we were missing, but what the possibilities are as we're moving and growing and really kind of going forward into this ecosystem of healthcare and the changes that are coming about within it. And that's, if you want to be at the forefront and be ready to provide your patients with the best care, athenaOne and the vision, everyone is so sick of hearing me talk about this when they talk to me about EMRs that I know. It's just that idea that athenaOne is constantly looking for ways to improve the experience for everyone and improve the care that you're able to provide to those patients. And I think that speaks volumes for any entity that at our core in healthcare, that's what we want to do, and that's what athenaOne strives to give us. So
Yeah, that's fabulous. Well, thank you, Tina and Amy, for your thoughtful responses to all the questions. It was a pleasure having you join us today for the panel discussion. And I think I'm turning it over to you, Tim.
Yes, sir. Thank you, Ken. And thank you, Ken, for leading this panel. And Tina and Amy, great to see you. And thanks for your time and your wisdom. And not to speak for Tina and Amy, but I will say that I feel confident that anybody who would like to speak to them directly, I know they'd be happy to do that. So if you'd like to do that, just reach out to any one of us at Athena, your CSM, salesperson, me, whoever, and we'll get you connected if you'd like to do that. I know they've done that a bunch of times. So again, thank you, Tina and Amy. All right. Absolutely. Well, their closing statements were so powerful. I almost don't want to close, but I am going to just do a couple of things here. for you folks just before we end. And I just want to sort of summarize a little bit about, sort of what athenaOne is all about. So again, we think of it as, delivering value across your business with our unique partnership model. Again, this idea of a network powered intelligence, truly a single instance multi-tenant platform that helps everybody get smarter. And a quick example of that, if those of you are familiar with Waze, I pull my phone as a prop here again, that's a network that helps everybody get to where they're going faster, right? Because everybody's driving around on the network, feeding information in, and because of that, it helps us all get there faster. And athenaOne works very much the same way. It's not just technology. It is certainly probably the most advanced technology in this space, but beyond the technology, there's services as well that we deploy for our customers. And it's all about outcomes, not just a piece of software. And it's an overused term for sure, but you heard it from our customers as well, too. I mean, we believe in partnership and in a performance-driven partnership. And one quick example, sort of the opposite of the way you may think about this is, for sure, we're very much invested, as you heard, about helping our customers be more successful. And by doing so, we're more successful. But the flip side of that actually is when COVID hit and you all got crushed, with collections dropped dramatically, our customers paid us less as well, right? And I don't think you have any vendors that turned around and said, hey, you know what? You're making less money, so we're going to charge you less, right? So think about it from that perspective as well, too. It goes sort of up and down this performance-driven partnership model. And just to brag a little bit as well, we have won lots of awards over time, and we continue to do so. In fact, you see all the class awards on there, and I fully expect that when class announces their awards soon, we'll be probably doing pretty well there as well. So I just want to again say thank you so much for your time. Before you go, if you have an opportunity, we would love you to take our survey. We think of ourselves as teachers and learners here at Athena, so we always want to learn from our customers as much as we can. And you see that poll has just popped up on the screen there for you. So if you can just take a second to go ahead and fill that out, please do that. If you want to add another question in there, if you had as well too, but we use that information to try to make sure that these events that we do are improved each time. So again, thanks for your time. Thanks for being a customer, and have yourselves a great evening. Take care now.